Well, first of all, good morning, everybody, and thank you for being with us this morning for what we hope is going to be an insightful, interesting, and hopefully educational session. So, just for everybody to know, my name is Hinda Daggag. I am a director at PwC Healthcare. And I am here to moderate this amazing session. So perhaps before we get into it, maybe we can just go do a round of introductions, just to let us know your name and what you're currently doing, and perhaps what the focus for you is within the field. So Dr. Andrea, maybe we start with you.
Yeah, thank you so much for the invitation. Can you hear me?
Is it working, the microphone?
Can you hear me? Yes, better. Okay, good. Andrea Maier, I'm a professor of medicine at the National University of Singapore and in a free university in Amsterdam. I'm a clinician scientist, being an internal medicine specialist, really pushing healthy longevity medicine into the clinical practice. In research, my group is really focusing on finding biomarkers to see how old we really are, so the biological age determination, and then we do lots of randomized control trials to see what kind of interventions we have to make somebody biologically younger.
Thank you.
Thanks, Andrea. Good morning, everybody. My name is Phil Newman. I run Longevity.Technology. We are the industry news publication and analyst group that looks at the whole longevity field. I entered the market in 2018 and I've seen it grow very significantly over these last few years, and I'm very excited to be part of this industry. It's going to be the career for the rest of my life now, because it's going to take a long time to have this industry working, and yeah, I'm looking forward to joining everybody today.
Thank you, Phil. Thank you so much. Please go ahead.
Thank you very much. My name is Dr. Miriam Matara. I'm a physician and scientist with a special interest in epigenetics. I was lucky enough to pioneer the region back in 2011, talking about longevity, or how you recycle your biological age, with a great impact and emphasizing on legislation and empowering the community, especially the young generation. And we were able to do all of that through Sheikh Zayed Genetic Research Center. This year we are celebrating our 20th anniversary by contributing to our lovely young country with 6 legislation which are in place to improve the quality of the newly born citizen and resident in my lovely young country, and to recycle the biological age. And namely, some of those legislation which I was so proud of, with the great support of my leader and 17 nationalities who came on board: banning smoking in public area, obligatory pre-marital investigation for common genetic disorders with a very thorough family history taking, as well as sexually transmitted disease, fortifying wheat with folic acid, increasing the neonatal screening from 3 to 12 for anybody who born in United Arab Emirates, and to increase the emphasis on some biomarkers which increase the risk for non-communicable disease, namely familial hypercholesterolemia, diabetes type 2, and depression with obesity.
Thank you, Dr. Mariam. Lovely having you.
Thank you so much. Thank you so much for having me, and congratulations to all the organizers for this session. My name is Dr. Evelyne Bischof. I'm a professor at the Shanghai University of Health and Medicine, and also at the University Hospital of Basel. I'm primarily a clinician and longevity physician, and focusing on application and translation of geroscience into the clinic. But at the same time, one of the focuses and my passions is really, as an internal medicine oncology physician, to bring longevity medicine aspects into the sick care and vice versa. So really to immerse and merge that. And another aspect of my passion is longevity medicine education. So I've been lucky to be a co-founder of a program that is CME accredited for longevity physicians, or for whoever wants to learn longevity medicine. And this longevity education hub educated already over 6,000 physicians all around the world. So it's a great pleasure and honor to be here in this region and seeing the developments here and participate.
Thank you, Dr. Evelyne. Thank you very much, everybody, for the brief introduction. So maybe we can get started, dive into the questions. So just to set the scene right, I'm going to start with you, Dr. Andrea. You're kind of the first one next to me. So perhaps you can just help us set the scene by defining some of the terminology that is usually used. We could potentially start with the word longevity, and what do we mean by that in this context, but even more so maybe health span versus lifespan, the chronological age versus biological age, just so that we kind of understand what we mean by these terms.
Yeah, I think it's very important to get the terminology right. So the first two things I would like to discuss is health span and lifespan. Lifespan is the number of years you are on Earth. Health span is the number of years you are not with this, or you are healthy. So the definition of health span is not really defined. Some countries say health span is defined the number of years without a chronic disease. Some say without a disability. So that also means that most of the countries, the population switch from being healthy to non-healthy when the first disease occurs. So the health span is roughly 50 years. However, if disability is being accounted for, then it's 70 years. So the gap between health span and lifespan is roughly 10 to 30 years, depending on the definitions. So that's one thing. Okay. The second thing is biological age and chronological age. So the chronological age, hopefully everybody knows what that is. The biological age is the age compared to your peers of your same chronological age, how fast or slow you age, what your biology really looks like. So at the age of 45, you can be 40 or you can be 50. So very often in cohorts, we see that there is a standard deviation of roughly 3 to 5 years from the chronological age, which means if somebody is biologically younger, it's very likely that the pace of aging of that individual is slower, because the biological age is younger. If the biological age is older, then it's the other way around. It's a little bit more complicated than just saying my biological age is 38, which is not true. Because we now know, looking at the physiology and the biology in our body, that the pace of aging within our organ systems is very different, which means my heart age might be higher compared to my brain age or my lung age, etc. It's not only that the age is different, but also the biology behind this might be very different. So I might have a telomere problem in my blood, and I might have a mitochondrial problem in my brain, or a proteostasis, or whatever. So we now really understand that the pace of aging is different, and there was very likely the biological age. So, but what we want to achieve is healthy longevity, and that's the reason why we now coined the term healthy longevity medicine. We have a society bringing healthcare professionals together, and that's really antagonizing the aging process and optimizing the health of individuals who are aging. We all are aging at this moment in time.
Okay.
Hope that helps.
Yes, absolutely. So you can keep the mic. Yeah, you can keep it. Just for one more question. And maybe, talking about the chronological age and the biological age, actually, and the fact that our organs age differently. Maybe it's something that we can kind of discuss a little bit more further down the road. But what I wanted to ask you is also related to the title, obviously, of our panel, from diagnostics to interventions, building a longevity protocol. So when we are talking about the longevity protocol, if I'm not mistaken, it would be the set of practices, lifestyle choices, and medical interventions that we can apply within the healthy longevity medicine field. And one of the things that you mentioned in your introduction was biomarkers. So can you maybe tell us a little bit more about the biomarkers of aging, and what do we mean by that, and how do we use them, and how do we validate them even?
Yeah. Hopefully now everybody is curious what their biological age is. Hands up who knows their biological age?
Oh.
No? Okay. So the biological age can be determined with biomarkers of aging. There's now a big consortium worldwide bringing clinicians, scientists together. Lots of investment is there to really measure the biomarkers of aging well. Biomarkers of aging can either be molecular. Think about taking a blood sample, looking at the telomere lengths, which is not a good predictor, by the way, looking at epigenetics, looking at the genome. Then we have clinical biomarkers. Think about putting yourself on a treadmill to see what the VO2 max is. Think about heart rate, but also we have now digital biomarkers. I see lots of smartphones here, lots of smart watches. Yep. So now we can measure physical activity, lifestyle factors, etc. So we have 3 different big domains of biomarkers of aging. And then we know how biologically old, with lots of algorithms, machine learning behind it, we now can understand, okay, this is the biological age, with an accuracy which is quite okay. It's not perfect yet, it's a very, very early field, but we can already transition that into clinical practice. For example, measuring a VO2 max should be implemented in all clinical practices, if you're asking me. Some of the biomarkers biologically are also already transitioned into clinical practice. While having these biomarkers, while measuring them, we can then define how to lower the biological age of these individuals by targeting what's going not so well. I'm not saying it's wrong, but not so well. And to find the interventions, and when we are talking about interventions, we have 4 very big groups, and that's environmental interventions. Think about noise, there's lots of noise here. Think about light, think about surroundings, if there are trees, if there's the social environment. So the environment plays a very, very important role. Then we have lifestyle interventions, which is of course very associated with the environment. Think about physical activity, food, but it's not only now looking at the WHO guidelines, 10,000 steps and eat less. I think that's not good enough, because now we know and understand the biology of an individual better with the systems biology approach. So we should really target, okay, how much balance, how much endurance, how much strength should somebody do? Sleep was already touched on, very important, but we also have supplements, and supplements very often are over the counter, but these are very potent molecules, or could be potent molecules we are using in randomized controlled trials to actually see if they could change the biological age of individuals. Then we have drugs, repurposed drugs, new drugs. So there's a whole arena which is either in research or already in clinical practice, and then merged with the biomarkers of aging, and that's a new field, health and longevity medicine, which we are proud of. Dr. Evelyne Bischof, together with me, we founded the Health and Longevity Medicine Society, really bringing it to the clinicians and making, I would say, healthcare healthy again.
Absolutely. I have to say, from a personal experience, I do take supplements, but I don't know my biological age, and I don't know whether the supplements that I take have gone through the validation process and whether clinical trials have been applied or not. So, you know, I'm sure I don't know. I don't want to say a lot of people like me, but, you know, I think this is something probably that we need to work on and highlight, just like you
I think,
said.
may I just, very important is matchmaking. Matchmaking between what is the biology of a person versus what kind of interventions you are doing. There are lots of interventions which are not working for me or for you because my biology is different.
Exactly, and that takes us into the personalized sort of a care arena. Okay, thank you very much. I will move on to you, Dr. Mariam. We obviously, for people that have been in the UAE, you know, you are very, very well known, prominent person here, especially pioneer in public education, through all the work that you have done in the UAE Genetics Diseases Associations, and congratulations on the 20th anniversary in that. But one other additional thing that you are doing is that you are being an advocate, you know, and an active contributor to the longevity field, or the healthy longevity medicine field. So I wanted to ask you if you can tell us a little bit more about the work that was done or is being done in this field, especially in the UAE, and also to perhaps give us a little bit more of an insight about the things that you specifically mentioned, like the epigenetics, I guess, you know, the regenerative medicine area of the longevity. So if you can just provide us a bit more information.
Thank you very much. Once again, I'm so happy to be here on this panel. And again, Dr. Evelyne, she's not only a colleague, she's a friend and sister. So usually when you talk about United Arab Emirates, it goes back to 2011 when I came back from Japan, where I did my clinical genetics. And Japan at that time, if you talk about longevity, you need to talk about Japan and full stop. At that time, nobody was talking about it. They were living the longevity practice and the approach as well. So when I came back to my lovely young country, being a physician and scientist, I came to know the essential role of lifestyle, especially the sleep and microbiota. And you can imagine in 2011, nobody talks about longevity, nobody talks about microbiota, not even our colleague in GIT, and sleep. So having these three elements, and I was lucky enough, as you know, to be the first woman in the history of my lovely young country as Undersecretary of Public Health and Primary Health Care. Having such authority and connection, I knew and I understand the role of legislation, because in the end of the day, if the legislation are in place, budget will be in place, and the other sector will play in a proper guidelines and roadmap. So with the great support of my community, I was able to empower the decision maker and the community to take the role and to understand and be aware about the available, accessible tools which will help them to improve their quality. And at that time, I was not able to talk loudly about longevity because culture-wise, religion-wise, people will not accept it. So I had to focus that you will live healthier for a longer time. And being, unfortunately, one of the highest prevalence of diabetes and obesity in the whole world, that was another aspect which we need to tackle, and especially when it's come to smoking. But I was not able to wait till that time. I applied many things on myself. So when I was in Japan back in 2011, they had only 12 biomarker in which you can follow up your, it was not called biological age, how efficient is your organ when it's come to function on the mitochondria level, on the cell membrane, the double phosphoslipid, as well as on your hormone. And then I tried to apply some of those knowledge, but coming to UAE and being from United Arab Emirates, I had some of the red flag which should be raised, especially gender and ethnicity. Being genetist and understanding the value and the impact of ethnicity on even supplement like vitamin C, with my full respect, you cannot do that before doing a genotype. So I had to come up, Hinda, with a new approach where some of the colleagues even they will tell me, Miriam, why you are doing a gene screening? He's have no complaint. You manage his diabetes, full stop. So having this notion and trying to increase the awareness among the community, it helped a lot, especially the physician. So I focus on a primary healthcare clinic, and I focus on colleges and universities from grade 1. So from first year of college. And you cannot imagine, Hinda, the awareness which increased in my lovely young country. Oh my God. And I can share with you a small example which is with an outcome and something tangible which everybody can understand. For example, now I am 49 years old. My biological age is only 28. And I can prove that not with my marker. I prove that with my regular period, which is 5 times per week, 5 times per month, 5 days per month. So these are some biological marker where any female would like to follow without even paying God knows how many dollars to go and monitor herself to be able to be aware about it. So we'll give you a very small example about United Arab Emirates. I am from a city called Hatta. It is a mountain area where my grandfather, he passed away when he was 102 years old, even before COVID. My grandma, she passed away when she was 98. All her teeth is there. She does all her chores by herself. And all what I asked them, I said, can I examine your stool, grandma and grandfather? So when I saw only the stool of them and the diversity of the microbiota, no wonder why they have a very stable neurotransmitter, serotonin, norepinephrine, GABA, all are very well standardized. Even all the C-reactive protein, all the inflammatory markers is not existing with such age, and they have even no focal core for cancer. The other area where I believe I had a great chance to contribute and give back to my lovely young country, many people and many colleagues I respect, and I learn a lot from them, but with my full respect, nobody should take resveratrol. Nobody should take NMN. Nobody should take any supplement without even going first. They need to examine a very common genetic cancer in their ethnicity before taking these. For example, if you have a focal point for any cancer related to your genes and you are not aware about it, you don't have the marker, and you will go and take one of those supplements which will increase your mitochondria, you can imagine, Hinda, you will speed up any cancer focal point. And unfortunately, I didn't find any single physician, with my full respect to everyone. I attended all the meetings and conferences about longevity since 2014. There is no single physician who prescribed any supplement without doing a biomarker for common genetic cancer related to ethnicity. So here where sometimes people they think, some people they don't like me so much, but I try to do my best to my country, to be a gatekeeper and to learn from colleagues, but in the end of the day, having my community and our ethnicity and our genetics in mind. The final point which I would like to highlight as well, Hinda, gender. I will always, people they say, Miriam, from where you get this protocol? I said, I don't have yet, but I'm developing. So I always tell female, please, if you have your period during those 5 days, stop all those what you are taking for longevity, for whatever. Please make sure to understand that we are completely different than our male colleague. We have a lovely biology. If your physician will not ask about your period, will not ask about your sleep, change your physician if she will tell you to go ahead with that. I am not strict, but sometimes I get so annoyed when I see some patient, they come, Doctora, sorry, I was fine, but how come I have no family history of cancer? I did the test, they said I don't have a mutation. The test which you've done for cancer mutation didn't represent enoughly her ethnicity in that particular test, where she was given negative result. So these are areas where I believe when we talk about longevity, we need to bear in mind how to maintain the health of individual in relation to ethnicity, gender, and environment. For example, everybody talks about how good is green tea. With my full respect, it's not recommended for Middle Eastern. It's recommended for the microbiome of my colleague who's living in Japan and Far East. So these are some of the areas where I'm trying to promote in my lovely young country and getting the knowledge from the source.
Thank you very much, Dr. Mariam. And I guess this goes back to what Dr. Andrea was saying about the holistic approach, about looking at different areas, whether it's the environment, the genome, and everything else that we can incorporate into it. And I'm probably not the only one who's waiting on your protocol, so you will share it hopefully soon with us. Okay, Phil, maybe we can move on now next to you. I'm sorry, we are sharing one microphone, so obviously you come from a bit of a different background, and you look at all of this from a different perspective. You are an entrepreneur with a huge knowledge within the longevity area and the business, let's say, of longevity. And it would be interesting because of that specifically. And of course, also I want to say that I'm subscribed to your newsletter, and I do religiously follow it really on a weekly basis. But it would be interesting to hear your thoughts or your perspective really, like from a personal experience, having visited many different longevity clinics, how do they operate, and especially with that kind of focus on the longevity protocol, which is what we're talking about.
Of course. Well, I guess the key thing is information. So we've talked already about biological age and chronological age, and I wanted to share just one story between my wife and myself. So we both had the same test. We were both aged, at the time we were both aged 55. I was 10 years younger than my chronological age, and she was 8 years older than her chronological age. So there's 18 years epigenetically between us. And the key thing is that changed her perception on what I was doing. She thinks what I do is nuts, right? So we've talked about supplementation and so on, and exercise regimes. Once you start to buy into this, you understand that there's much you can do. And my wife did none of those things. So now she does. And she is now working on her biological age. She's changed her diet. She's changed her exercise regime. And this is all about information. And if you are in the position where you are privileged enough to be able to go to a longevity clinic, of course you get a lot of information. And of course a lot of that information is confusing for people that are non-clinically trained like myself. So you need guidance. People like these wonderful people on the panel with me here, they can help people like me understand what I need to do. And I guess it's really a combination of the basics, as we all know. It's all about your lifestyle, but also the interventions that you can have. So I went to 2 longevity clinics. They identified for me 2 underlying conditions that I was asymptomatic for. So I'm 57 tomorrow. So I'm in the danger zone for certain diseases, and it was discovered on one visit that I had microvascular disease. So they were doing tests on me. They identified that obviously those small veins in my body were now starting to clog up. And of course, the good thing is that that's reversible. So they've worked on my supplements regime. So I was given certain supplements, a statin, and an exercise regime. And I did a follow-up test 9 months later, and the markers were pulling down. So I'm on my trajectory for that. Very interestingly, I came back to my wife. We're a sort of N of two, the two of us together. And I explained to her what I was doing with my cholesterol, and she decided she was going to go and have her cholesterol checked with our GP. And it turns out that she's got familial cholesterol, and her score was off the scale. And of course, all my children have that information now as well. So what you get from the experience of going to these clinics, you get your personalized regimes. But I guess the key thing is that you can bring it into the family, you can bring it into the people that are around you. Because the key thing is that if you start early, you know, when you've done your damage earlier in your middle years, a lot of that damage is done. So if you can help people to start early, then that knowledge is very important. And that's what I've done with my family. My kids now, they get all the instructions I can give them. They don't listen to me most of the time, as you can imagine. But my youngest is 20, my eldest is 30, and they're really in that point where they've got the optimizing attributes to their life that they can really do it if they wish to. They could be in a position where all the things that we talk about as a very early stage industry, they can be employing them in their own lives.
Yeah, how amazing is that we can actually now raise the awareness and educate, you know, our kids and the future generations. And we already can see that shift, I believe, happening, like you said, in your own family, and I'm sure many other people. Now, that is one of the many positive things that's coming out of the industry. But have you identified any challenges when it comes to, I guess, these protocols that are being developed? You know, are they being standardized? Are they different from one clinic to another? You know, how do we address this?
Yeah, I'm looking at this as an industry, as a market.
Yeah.
So I'm sitting on the top and looking at all of the cycles as any industry would go through. And I think that what two of my panelist colleagues are doing is wonderful. They're creating a industry society, and they are looking at baseline standards for that industry. And as each industry goes through its cycle, having standardization is very, very important. So standardization in how you're identifying biological age, standardization on how you run clinics, standardization on the sort of level 1, level 2, level 3 that you may have as a protocol when you go to a clinic. So perhaps you may go to Andrea's clinic in Singapore, and then you may go to a different clinic in Florida, and you're going to have a similar process that you're going to go through, so that if you do go, you migrate or whatever it may be, you're in a position where you've got a standardized process that you're going through. The industry isn't there yet, but we're going to get there, and I feel that everybody in the industry feels that we now need to do that. And of course the key thing is also how we standardize understanding biological age, you know, whether it's grip strength, whether it's walking speed, whether it's your DNA methylation, whether it's your telomere length. All of those things are really important, so that when I say I'm 10 years biologically younger, the clinicians on the panel believe me, right? Because they know the tests that I've been through. So this is the next stage that we're going to be going through. So there's a maturity cycle that the industry is now stepping into. There's going to be some beef because it's going to get harder, you know, because we're addressing some of those more tricky questions that we need to be taken seriously, because we're now moving from the interface of being a closed industry now being part of mainstream healthcare, as we're talking about on this panel here. And really we have to step up and make sure that as an industry we're ready to feed into the mainstream, and we are doing that, but it's the next wave of the cycle, so it's going to get a bit tricky for a few years.
Yeah, a bumpy ride, as they say, but you know, I think things have to get harder before they can get easier.
Indeed.
That's usually how it is, right? Dr. Mariam, you were about to say something? Dr. Evelyne?
Again, I have my own opinion. I might be wrong. I wish there shouldn't be any longevity clinic existing. It should be a protocol which is embedded in all the specialty of medicine. We need to respect that. In my opinion, it should be in primary health care. We need to make sure that people get healthier. In my opinion, we shouldn't have a longevity clinic. It shouldn't be existing. We need to have each physician, especially in primary health care, empowered with the knowledge from expert, where we can have a guidelines, it should be applicable for everyone. And we shouldn't wait for an individual to age. It should be started even before conceiving. So if we will tend to have longevity in one sector, it only serves the market and economy for those people who want to do money.
Yeah.
But again, I have the privilege to talk on legislation level. It should be embedded within the system, so even the poor people, they will get the right intervention early enough before reaching their 20th or 30th. This is my humble opinion, and that's what we will look for in my lovely young country, and we will do it smoothly, that longevity will be embedded in all the subspecialties, not as an isolated longevity clinic.
Absolutely, and that's actually a great segue into what I wanted to ask you, Dr. Evelyne, and maybe that's the comment that you wanted to make anyways. Unfortunately, the reality of the situation right now, at least, is that really the healthy longevity medicine field and the interventions and the applications are perhaps available for the more fortunate people. It isn't yet available for everybody, and we see it more in the private sort of a ecosystem rather than the public ecosystem. So could you perhaps elaborate on that a little bit more? Is that really the situation everywhere across the globe, and what could we do? How do we push it outside of that of those boundaries and make it available for everybody?
Right. I think in the field we are still very fortunate. I assume here, and we should not make assumption, but I assume that everybody who is in the field is passionate about healthy longevity for all. And when we say for all, it means all countries, all continents, all ethnicities, and all social layers. The more we work together, the better it goes. So I think every time, and I'm grateful to cite Dr. Mahmoud Khan when he said we have to collaborate and coordinate. Collaboration is going on many levels, and coordination has to be done by some people who can coordinate and lead. And I think in the UAE, luckily also in other countries I was fortunate to work with, China for example, there is a good coordination because the government has realized the economic impact of healthy longevity medicine for all. And I think we have a good collaboration, right, Andrea? We see that the private and the public sector, at least we are trying to work together, because we have to start somewhere.
Yeah.
And we don't want to have only N1 or N2, but at least N20. So this is where we start to learn. But I think the end goal is really to have it for everybody. And education is more important than we might think. People assume that education is just one part and we should focus on actually targeting the patients. I agree that's very important to work with the patients, but the faster we educate physicians, populations, and stakeholders, meaning healthcare insurances, governments, the faster we will get to our goal. So in education of physicians, we are actually focusing on targeting family physicians, GPs, internal medicine physicians, because those are usually those who see the patients first, but also all the other disciplines. And one of the ways how we can get really longevity medicine for all, that will be not only in private sector, will be, as Dr. Matar mentioned, embedding in disciplines. And I would just give one example. So we are bringing now, and that I think it's a revolutionary step, we are bringing longevity medicine into the core medical curriculum, meaning the doctors of the next generation, as soon as next year, in some countries, will have it as an obligatory part of their education. So they will not have to learn online, they will not have to learn at conferences, grasp different levels of educational credibility, but they will be taught in the schools. And what's very interesting, when we were working with those universities and med schools, public health schools, medical schools, they suggested us not to do it as a separate panel, but to embed it in the core curricula of internal medicine, cardiology, oncology, and so on. That's number one. And number two, if I may also mention this, I think, I know there's much debate that only more wealthy people can afford longevity medicine and less wealthy not. I look at the other part. We say healthy longevity medicine, and we are indirectly suggesting that we want to see the healthy population and make them better. Of course, we would prefer that, but most of the people have some sort of comorbidity already, even at a young age, and they have cancers. And incidence is growing all across. We don't want them to feel that they are excluded. And luckily, many of the biological age clocks now are developed for specific subpopulations: cancer patients, cardiovascular disease patients, patients who are with genetic disorders that are carried out as mutation carrier. And I think that's the way to go, rather than looking at what could divide us. Look where we are heading to, and I think the goal is really the same here.
And I guess it's kind of, we don't want to go from one extreme to another. We were in the extreme of really, it's the business of sick care, right? Rather than healthcare and taking care only of people that are already sick. Now we're kind of shifting that paradigm and saying, well, we only want to look at the healthy people, you know, and we want to help them optimize their health. But in reality, both of these worlds exist or coexist, and we want to kind of bridge between them and balance and make sure that we take care of both ends of the spectrum. I just wanted to ask you one more question on this topic. Are there any currently existing public healthcare systems or public hospitals that are implementing healthy longevity medicine?
Luckily, yes. We actually have one as our collaboration efforts of the society network of the 3 first public hospitals, or more open hospitals that implemented longevity centers. So that's Singapore, that's Mayo Clinic and Sheba. The beautiful thing of being there is to see how more appreciative the colleagues from other disciplines are when they actually see that it's in their place. But it takes a very visionary CEO and a very generous person sitting in the HR for the budget, and a very, very generous person in the ethical commission for allowing clinical trials to be run. The trend is growing, which is very nice. In China, we also have one. I mean, probably there's more countries. I know of one. China has also implemented, finally, in one of the biggest networks of healthcare insurances, a package for longevity medicine a year ago, Ping An. I think those little efforts will have a big impact.
Wow, that's very impressive. So I actually didn't know about that. That's very exciting. I think just to kind of, I had more questions, but unfortunately we have to close the session. So I think maybe we will close it on one question that would be directed to all of you. Maybe if you take a minute to just respond. I just wanted to kind of bring this back, the full circle, and come back to where we are right now in Abu Dhabi. Obviously, you know, here at the Institute for Healthier Living in Abu Dhabi, which is a precision and lifestyle medicine company, really, right? Which is trying to address all of these issues that we have discussed. Now, it might be one of the very few, if not the first company in the UAE that is doing something like this. So I would like to hear your opinion. What sort of responsibility does that bring or put on the Institute for Healthier Living in terms of what they need to deliver, considering that maybe they will be leading the field here in the UAE or maybe globally also? And also, what sort of advantages do they have, or does the UAE have as a young country, as Dr. Mariam was saying, to be able to really be the global leader and spearhead the healthy longevity medicine? So maybe if you can take just 1 minute each and just, please, you're already holding it, so Dr. Evelyne, go ahead, it's okay.
I would rather give it first to Dr.
It's
Matar
okay.
from the area. I would jump on the second part.
Sure.
I think it's rather accountability and great chance and great honor for somebody to be pioneering in the region. And when I say region, I mean the entire region. So UAE is extremely visionary. I'm deeply respectful of what is being done. I think the whole region is very active as well. Saudi Arabia, by far, with a great respect. I think bringing the right academic binding into this, bringing a lot of new talent, regional talent, let them grow, and implementing a lot of knowledge from this ethnicity ethnicities. Actually, it's a huge, actually, it's a huge, great, interesting epigenetic mix. Would be something that that I would be very much looking forward to see in the next upcoming years to come.
Oh, thank you very much, Dr. Evelyne. Please, Dr. Maria.
You are my guest.
Okay, I'll go next. So when you look at a population pyramid of a developed Western European country, you get a smaller base, a wider middle, and a thinner top, which demonstrates that there are fewer babies coming into the supply chain and there are more middle-aged people in the middle. So by 2050, globally, there will be 2.1 billion people that are aged over 60. And 85% of those will be in countries that are not primary developed countries. So we have an international issue that we have to think about as mankind, humankind, that really what we've got to do is take the work that obviously the Institute for Living will be able to permeate out into its own society. You know, the UAE, the GCC has got a beautiful pyramid, lots of healthy babies at the bottom, right, and lots of talent coming through. There's an amazing opportunity to take this, not contaminated by what we're dealing with in places like the UK, and really use that to a great advantage and then scale that globally. That's what I see.
Thank you. Thank you very much, Phil. Dr. Andrea.
I would like to first congratulate the Institute for Healthier Living for establishing this. Dr. Nicole is, I think, somewhere here.
She's somewhere.
The leadership team is really fabulous. And there are two components. The first component is clinical practice.
Yeah.
In the clinical practice, get all the data and learn, because nobody has the protocols yet, I think. We are not at the stage where we can say we are the highest level of evidence-based medicine in the healthy longevity medicine space. So really implementing into clinical practice the analysis of data and the daily learning with all the methodologies we have in hands at this moment in time. Think about, yes, ChatGPT and machine learning and all the other things, but also really binding the best clinicians towards the clinic, because in the end, we are human body and we understand the human body. I think the second part, which is beautifully being established, or is going to be established, really establishing the epidemiological research, understanding epidemiology in this area.
Yeah.
Think about the genetics, think about the environment, and then the co-creation, and will end up in epigenetic changes. And while learning together with international partners, and I'm very unfortunate to be an advisor of the Institute here. Thank you for asking me. I think implementing that in a sort of living lab in the clinic will then grow protocols for this region, because the eating habits, the environment is different, and we have to adjust to really understand the epigenetics. And I will give you the microphone.
Dr. Mariam.
Thank you very much. Again, Nicole, thank you very much. And why I was so optimistic, and even I didn't refuse to be advisor for the Institute from the first invitation. The name itself, it's not an institute of longevity.
Yeah.
It's very attractive and it speaks by itself. It's healthier living. That's what will make it different. And the second point, it's coming out of Abu Dhabi, our lovely capital. It's United Arab Emirates. And so allow me to, I'm not bragging about my lovely country, but history documented that many things for the region, if you want it to be successful, it should start in United Arab Emirates, cultivate in United Arab Emirates, the pilot process should be in United Arab Emirates, and the rest of the region, they are not a follower. The rest of the region, they trust us. They trust the system in United Arab Emirates. Because of that, it smoothly get integrated within the rest of the region. That second point, which I'm looking forward to see, and allow me to request this for all our international experts. I wish if they can have more insight about what we need, how is our, not only ethnicity to talk about gene, but to understand that this part of the world is so unique. We have 202 nationalities. Let's not only focus on Emirati, we have other people who's living here. And in my opinion, this is a golden opportunity where we can study 202 nationalities. Maybe they are coming from 5 major ethnicity, but with a strong evidence base. And I don't agree with Dr. Andrea, which is very healthy in science and medicine. We shouldn't wait for any clinical trials. We shouldn't wait to do more evidence-based, in my humble opinion. We have now artificial intelligence. We have a wealth of knowledge of the past 20 years. Let's talk about United Arab Emirates. Our medical file was established back in 20 years ago. So if one setting, if we have a national project where we will dedicate people to look on those files for people who had cardiovascular disease, any of those disorders, let's recall all their biomarkers. Let's get it done, and we can come up with at least more real crystal-like the landscape of how things progressed, how far, how soon. Because in my opinion, that is a knowledge which will help us and will alarm us what is the speed we need to go in for developing this sector, and what should be our priority. I finalize with another interesting part of my lovely young country, Dr. Andrea. With my full respect of my old colleague, for me, when I would like to know more about it, I am a community physician. I have no good experience before 2011 in longevity. But for me to gain this, I was trying to tackle the information from my colleague in Harvard, UK, name it. But I came to know a wealth of knowledge of 5,000 years is there in China. It's the only language which still today are written and read. So they have everything documented in a wealth of 5,000 years. And when you get the information, Dr. Andrea, you can see, oh my God, they are using the same plant, which today we are using it to control diabetes. But they are using it 5,000 years ago. So I believe as a scientist and a physician, we need to open our mind, open our hearts, sit in one table. China and America and all the sector, all the countries, they should come together, and we need to think about humanity. And UAE, we are opening hands, opening hearts for all those initiatives where we can start something to serve humanity and make sure longevity is not a separate clinic for wealthy people. A longevity concept is embedded in primary health care with each physician, whoever sees whatever is the disorder. This should be the aim, to serve the humanity. Again, this is my humble opinion and personal opinion.
Thank you, Dr. Mariam, and I guess it goes back to doing things for the right reasons. It's okay, I'll take it. And working together at the end of the day. That's really, as a human race, that's really what can push us forward. I think we ran out of time. I did have many other questions, but we're going to have to leave it maybe some of them we can address in our session on Wednesday. I wanted to thank you all for being here, and it was my absolute pleasure to actually moderate this session for you, and thank you for your insights. Thank you very much.
Can you hear me? I just want to thank our panelists, and also just remind everyone that Dr. Andrea and Dr. Evelyne will be on the main stage today at 2:30, talking from vision to reality, scaling healthier lifespans. And so we welcome you to come and join them on the main stage there at 2:30. We also have one of our other advisors, Dr. David Katz, who will be speaking on the main stage at 4:40 today, looking at the future of nutrition and blending technology, medicine, and sustainability. So just a sneak peek for more to come. Thank you all so much for your attention. Thank you, panelists, for your words.
Thank you.